does she need a pap smear done if she is no longer sexually active?
I'm just kidding. I said because you it's just a test.
Oh yeah, this is.
We're just trying to think through it.
Obviously not fake it yet.
Check for cancer if they have no history.
So what else does it check for besides cancer? Ms. Milton talked about it, how it was very rampant.
HPV.
Just waiting for it. You were just waiting for it.
Y'all didn't even listen to my spiel I just gave. Come on.
I was waiting.
So, even if this patient says she's no longer sexually active because she was sexually active before, they still need to get their pap smears. Now, there's a little bit of controversy now between providers about how often pap smears should be done. Some providers still say they need to be done annually. Some providers are saying that a female does not need to have a pap smear done until she's 20 or 21, even if she is sexually active. So that's kind of a newer dispute that's going on. I know a lot of the providers here in town still recommend that you have it done yearly. So the pap smear is going to detect for HPV. There's many different strains of HPV, and one of the big things that HPV causes is cervical cancer. So, like Ms. Milton said, HPV is very rampant. There's a lot of people who have it and they don't know they have it because they haven't had a pap smear or anything done, and they don't know until that they have it. It is treatable, HPV. It is also preventable not only by abstinence, but there is a vaccine now. Yes, Gardasil. It's a 3-series vaccine. It's been around, I guess, for like 10 years now because I had it. There's also one for males as well now.
Those shots burn.
They hurt like.
Your arm is sore that day.
Why would males want to get them?
They can't carry the barriers.
What else?
They can
They
get
can
it.
get it. They can get HPV.
What outward symptoms would you see? What can HPV cause?
Worse.
Along with cervical cancer. Okay, they don't have a cervix, so we don't have to worry about cervical cancer, but still have the other.
Yes. So the Gardasil shot is also another thing that's a little controversial. Some pediatrician and doctors recommend that all kids get it. I think now they've lowered the ages to 11. I think that you can start getting it. Don't quote me on that. It used to be like when it first came out, it was like 14 or 15. And then there's some doctors that say it doesn't work, don't worry about it. But it also, like I said, it helps prevent HPV. So you also, fun fact about the shots is if you have been diagnosed with HPV and are treated, and once you're cleared by your doctor, you can then go get the Gardasil shots if you've ever had them before. So you can still get the shots even after you've had it to help prevent it again.
I have a question real quick. With the Gardasil vaccinations, what's the immunization schedule for that? How should they be given?
Every 3 months.
The last one is like.
Y'all look. Let's look it up. Let's find out. Okay. So 3, 6, and 8 months. Is that right? That would technically mean that you're getting it 4 times. So, no. off
Parents
period.
don't have to pay any extra for the vaccination.
Every 2 months? It says it right here, every 2 months, but.
It says 3 injections. 3 injections over 2 years.
Every 2 months.
So 3, share what you found.
3 injections over 6 months.
So 3 injections every 6 months.
Over 6
Over
months.
6 months.
Mhm.
What is the nurse's priority when preparing a patient for the double mastectomy? Yes, so the big thing with the double mastectomy is this is not only has, the patient been diagnosed with cancer, but now you're going to go and cut her boobs off. So that's something that's very hard, for women to deal with, for women to comprehend. They're very anxious about it. Some women don't wanna have it done because they don't want to have to look at themselves or think about themselves or have their spouse or whomever look at them differently once this is done.
Our insurance is like paying for you now to get like plastic surgery to replace
I was gonna say for reconstruction, how expensive
Yeah.
is it?
So are you talking about after they've been diagnosed with cancer?
Yeah.
Yes, okay, so if the patient's diagnosed with cancer and then they have a double mastectomy, there's a couple of different ways that they can do it. Sometimes, right then when the patient's still on the table after they've cut everything off, they may, reconstruct them right then, or it may be, something that the physician waits on for a few months or so. So, but yes, insurance will pay for it, reconstructive surgery if it's from cancer. Now, if a woman just wants to go and have a breast augmentation, they're not gonna pay for
Right,
that.
right.
What about if they go ahead and have a mastectomy after they have the gene?
Positive? Yes, usually insurance will pay for that.
What we're seeing now, they're doing a lot of the expanders and then doing the augmentation processes.
Yeah. And it's different for physicians and, facilities. I know a couple people that have gone to UAB and had theirs done, and, on all of them, they didn't, do the plastic surgery right then. They had to wait, it was about 6 months to have the surgery done again. Like Brian said, they'll put in the expanders, they went through all the chemo and radiation and everything, and then had the plastic surgery done. So. DDT and hemorrhage would be major complications from what female surgery?
What is hysterectomy?
Alright, so you have your patient that has had a hysterectomy. It may be the total abdominal, or it may be the laparoscopic assisted. One of the things you're gonna be checking on constantly is your patient's bleeding. Another thing, with patients after they have surgery, what are they usually gonna be doing?
Laying
Laying
bed.
around on bed rest for usually 12 hours or so, or like until the next morning or something. So what's one thing you wanna make sure this patient has on at all times? SCDs. So that's a major thing. You wanna make sure from any surgery to patient, but especially the women that come in and have hysterectomies, they're more at risk for the DVTs and the hemorrhage. And again, you wanna make sure you're checking your patients, check their vital signs, their blood pressure, what's it gonna be doing if they're bleeding out, bottoming out, their pulse is gonna be up. Keeps that. What is a major complication of the transurethral resection of the prostate, also known as TURP?
Only small pieces of the gland are remaining prostate tissue may continue to grow and cause urinary obstruction or complications. Also, urethral trauma from their scope may result in urethral strictures. So we're gonna say? That the small pieces of the gland are, only small pieces of the gland are removed, so you can still have remaining prostate tissue that can continue to grow and cause urinary obstruction. And urethral trauma.
Infection.
Strictures. Resulting in urethral strictures. That's what we've got.
So, bleeding is going to be a major complication with these patients.
I mean, that's what I was thinking.
I thought that's just too general.
Yeah,
It's like a big complication.
Yeah, for everything. Bleeding
Okay, but, so that brings up a good point. You say bleeding is a complication for any surgery. Yes, it is, but you can't take that for granted.
Right.
Because if you're not checking on your patient, or if you're seeing a little blood and you're like, oh, they had surgery, they're gonna bleed a little, and then an hour and a half goes by and you've been busy with your other patients and you go back in and you go in and your patient's out cold, that little bit of bleeding turned into a lot of bleeding and they just died. So that's why you can't say something that happens all the time. You can't just look over it and take it for granted. So. All right. Jump to the pig, Eli. What is the nurse's priority when preparing a patient for a prostatectomy?
Support.
Or the anxiety, discusses
Yes.
surgery.
So, prostatectomy is a lot like the double mastectomy with the female, or if even it's just a single mastectomy with the female. They're gonna be very apprehensive, they're gonna be very scared, they're gonna be very anxious. It's not something that they're probably really gonna wanna talk about to you, or their spouse, or anybody. So your priority as a nurse is to just help relax them, help to relieve any fears or anything they may have about this procedure. Even though it's a common procedure, this is something that's not common to them. Alright, so a couple more things with the reproductive system is anytime you have a patient, don't assume their sexual orientation, okay? Don't go into your patient's room and ask them, how many females have they been sleeping with, or how many males they've been sleeping with. Don't assume anything, because you don't know what is going on with that person. If you have a patient come in and they are being abused, do you automatically report sexual abuse? Why?
Because if they consent, they have to consent first, correct?
They're not a protected population.
Why?
Because they have the right to.
Okay, so if you have a patient come in, so you have a female come in and she is being sexually abused by her husband. And she's come in, she's got bruises all over, it's sexual and physical abuse, and she is, you're telling her, you know, you can call people, you have these options, there's safe houses, y'all can send her to, stuff like that. If she tells you, no, I don't want you to tell, you can't. Right, she hasn't consented, but the main reason that you can't do that without their consent is because if the husband or whoever the heck it is comes in and he can abuse her again. Children and elderly, the only population that you can call for physical, sexual, verbal abuse, anything on.
And mentally handicapped.
And
Those that
mentally
cannot make their
handicapped.
own decisions.
Because
it's a disability mental
I think
handicap.
Shay said it, they're not protected. It's a really, really sticky situation when you have patients come in and they're doing that. And they tell you these things and then they tell you, no, I don't want you to do anything about it. So, but there's something that's very important and something you need to know because it will happen. More people are abused than you would realize, even if it's just verbal abuse. So, one thing you want to be sure when you are assessing your patient, because with the reproductive system, you are going to be, especially the females, like if when they're having their pap smears, what kind of gloves do you want to wear?
Sterile.
Sterile. So what's something you want to make sure with the patient?
Allergies.
Allergies, yes. That they're not allergic to latex. Right. Also, you may find a lot of time if the patient tells you they are allergic to latex, like if it's a male, and they tell you I wore a condom and maybe break out in hives, a lot of times they're actually allergic to the spermicide that's in the condom and not the actual latex within the condom. And how often do you want to teach your patients to do self-breast examination? Monthly. And when is it best to do it? What, Haley? Yes, after your period. So it's best to teach females to do their self-breast exam after their period. So now, Tiana, read number 1.
A patient has never had a herpes outbreak before, but her blood tested positive for HSV2. Is this reading a false positive?
What did you think?
I put no, because an outbreak does not have to be present to have herpes.
Right. So that doesn't matter if it's HSV type 1 or type 2. A lot of people don't know that they have HSV, have never had an outbreak before, and don't know that they're positive until they have blood testing done and then find out that they are. Also with HSV type 1 and type 2, generally type 2 is more genital, but we're finding more and more now that you can have type 2 in your mouth and you can have type 1 in your genitals because people are doing more things. So just because they're having an outbreak in a certain spot doesn't necessarily mean which type they have, and you don't know which type for certain until you do the blood testing to see. Okay. Number 2, Katie, read that.
Why does a nurse encourage blood testing for HIV in the patient with syphilis? I put because they're more at risk for HIV.
Yes.
So those that have multiple STDs are at greater risk for testing positive for HIV/AIDS. What, for HIV/AIDS, do you have to have any special consent for that testing?
Yes.
Yes, you do. You've got to have consent from the patient.
You have to have consent for HIV testing from the patient. Also, if someone is HIV positive and it has a partner and has not told their partner they're HIV positive, they can go to jail for having sexual intercourse and not informing the partner that they were HIV positive.
So I have a question. If you are aware that your patient has HIV and their significant other comes in, can you tell their significant other?
No.
Why?
Still HIPAA.
It's still HIPAA. What could you do for that situation?
Encourage them to tell their
patient.
He's got something to tell you.
Okay, so encourage, well, you couldn't say that in front of them, but encouraging the patient to express that to their partner, and you may need to let them know the risks of, not telling, and that they could transmit this to their partner.
HIV is something that a lot of people want to deny. They'll come in, you ask them, do you have any diseases, anything going on? No, I don't have anything, I'm perfectly healthy. Oh, well, in your chart right here, it says you've been HIV positive for the last 5 years. Oh, yeah, I do have that. They don't want to tell you that they haven't. And how do you diagnose somebody with AIDS?
There's a draw.
Less than
Sticking back in the ball.
200. 400.
It's 2.
somebody open your book and see.
He's like, I'm walking.
Y'all are throwing out a lot of numbers.
Come on, guys, active participation here. Look it up, look it up.
And y'all have already been tested on HIV and AIDS.
That was our first test.
It's been a while.
Your finals coming up.
Do that. It's like, you know how much crying you've done in the past?
The finals over everything. Bless her heart.
Finals over.
Desiree. Finals. Desiree. That's the finals, second to last chapters. Let me go back all the way to the beginning.
But I mean, like, yeah,
Here. Alright. Way to go, Shane.
I trusted Kobe.
Thank you for the TV review.
The diagnosis
Don't
of
trust
AIDS
anyone.
requires the person to be HIV positive and have either CD4 plus T cell count of less than 200 or less than 14% or an opportunistic infection.
Or an opportunistic infection. Also, if you have a patient with HIV and they become pregnant, it's very important to continue to teach them to take their medications, because if they take their medications, there is a less than 1% chance that the baby can get HIV from mom if the medications are taken like they're supposed to be. It's very important. All right, number 3, Eli.
A male patient returns to the ER with a recurrent urethral discharge after being treated for a chlamydia infection 2 weeks ago. Which statement made by the patient indicates the most likely cause of the recurrence?
What did you get?
I was thinking C. I don't know.
C. Okay, so let's look at it. A, I took the Vibramycin twice a day for a week. B, I haven't told my girlfriend about my infection yet. C, I had a couple of beers while on my medication. Or D, I've only had sex once since I finished the medication. So what is the consensus?
I put B. I put C. Because
Okay,
B
so
B says he hasn't told her, but it doesn't say they've had sex.
But don't say they haven't either.
Alright, so why do you think B, I haven't told my girlfriend about my infection yet?
Because he could have got it to her, if he got it back to her after his treatment. I would.
And so if he hasn't told her, has she been treated?
No.
Okay, so let's look at C. I had a couple of beers while on the medication.
Metabolic. I mean, you probably shouldn't, but I don't really think so.
Alcohol, like,
Alright, but even though he's taking his medication and he hasn't told his girlfriend about the infection, so how's she taking her medication?
She's not.
How do you know that?
This is enough information.
Alright, so the correct answer is B. I haven't told my girlfriend about my infection yet. So chlamydia and gonorrhea are both diseases that are reportable to the Department of Health. So anytime anyone is tested positive for chlamydia gonorrhea, it has to be sent in to the Department of Health. The biggest thing with the chlamydia and gonorrhea is you want to make sure your patients are taking their medications like they're supposed to. So if they're supposed to take the medication for a week, you want to make sure they understand to take it for that full week, not just a couple days after I'm feeling better or after things seem to be clearing up. It's also very important that their partner or partners, because they very well may have more than one, all get tested and treated as well. Because if their partner or partners are not getting tested and treated, and they're getting treated, basically that antibiotic that they're taking is not doing any use, because the people that they keep sleeping with are not being treated as well. So it doesn't matter how many antibiotics they take to be treated. If their partners aren't getting treated, they're not either. Okay? So number 4, Jessica.
Because HSV1 and 2 are recurrent lifelong viral infections, there is no need for patients to take medication. That's a false.
Good. Why is it false?
If you go back to number 1, sorry.
Yeah, that's fine, because they could have an outbreak.
Right. Okay. So HSV 1 and 2, if you take your antiviral medications, does it go away?
but can you keep it dormant for like a week?
Right. It will help make it dormant. So you want to, again, teach these patients to take the medications as the provider has ordered them to be taken. If patients have so many outbreaks within such a, short amount of time period, the provider may put them on an antiviral medication to help prevent an outbreak as well. And a lot of times these antiviral medications are like Valtrex, Acyclovir is another name for it. You will also hear people who have cold sores or HSV1. A lot of times you can hear them say the Abreva, which is over-the-counter medication. A lot of times that works for people as well. People usually will know when they're about to have an outbreak as well. They'll get a tingling sensation, whether it be, around their lips, on their genitals. A lot of times, some people may break out, might have more cold sores break out if they're out in the sun. A lot of people you'll hear say that as well. So, all right, number 5.
I want to add something real quick. Also, stress can also cause this outbreak to increase. What's one big reason? Well, obviously, why we take the medication. Okay, we have an outbreak, so we want to get the outbreak under control. Okay, is it just for an outward appearance, outward looks, or what's the other reason that we want it under control? Preventing spread, because the times that you can spread it from one person to the next is the time when you begin that tingling sensation, or those little oral sensations that that it's kind of impending, it's about to erupt, and then when the lesion is open and weeping. Okay, so if we're decreasing the amount of time that we're spending with those open lesions, then we're decreasing the amount of time that we're able to spread it to other people. Okay, so we're worried about our significant other, our children, whoever it is. You want to make sure that's another big reason for taking the medications and even suppressing those symptoms, because again, recurrent outbreaks, again, it affects appearance, as well as can cause scarring, but also again, transmission is one of the big reasons that we're going to want to take that. Okay.
And if you have an outbreak, just even of HSV type 1, be considerate of others, because I've seen a baby get HSV type 1 from somebody else who was obviously kissing the baby, and just in a matter of a day, the baby almost died. Herpes will kill a baby very, very quickly. It doesn't matter type 1, type 2, whatever it is. And there are little simple things like that, like a lot of people don't think of. So if you have anything, just be considerate of other people, and that you can transmit it to other people.
So education is going to be key for this. Education is going to be key for any STDs, okay? Because people have a lot of misconceptions about STDs, but you've got to educate them so they can. You can have a partner. You can have if you have herpes or whatever it may be. You can have a normal life. You can have a normal life, but you just want to be considerate, because you can have a normal life without transmitting it to a partner as well, if you're very careful.
Men cannot get infected with HPV since they cannot have a pap smear done to diagnose them. They can still get it.
So how are men tested for HPV?
Is it through blood? Or do they have like
I don't know. Maybe they just have the they have
blood work.
warts. I don't know. They can culture the warts and see.
Okay. So men are usually diagnosed. A lot of times the provider can just look at the warts and see, but a lot of times if no warts are visible, what they'll do is they'll put acetic acid solution on the patient, and once that solution is applied to the area, if there are genital warts there, that area will turn white. So, all right, number 6.
Patient comes to the ER with severe lower abdominal pain, irregular menses, painful intervals, a fever for 2 days, and heavy vaginal discharge. What will the provider likely diagnose with the elevated?
Did everybody hear him? PID off from the gonorrhea, chlamydia, HPV, and the endocervicitis is the severe lower abdominal pain. PID is very, very painful to patients. Patients come in, they get tested for gonorrhea and chlamydia. They might not even know they have it. They're not going to be in pain from it, okay? Same with HPV. They may be in pain after being treated for their HPV if they had a procedure done, but they're not going to be in pain before. A lot of times patients can be hospitalized for pain management for PID. Talk about syphilis again real quick. So syphilis has four different stages: the primary, secondary, latent, and tertiary stages. The big thing with syphilis is that it's very, very contagious. Has everybody heard of the Tuskegee experiment?
What?
Okay, so the Tuskegee experiment was an experiment done in Tuskegee, Alabama. I think, was it the 30s? It was way, way back when. They had African American, mostly males, come in for this experiment, and they were treating them, but they didn't even tell them what they were testing them or treating them for. And some of the people did not get treatment. They got the placebo treatment, and they knew that these people were positive for syphilis, but were not treating them. And so essentially a lot of these people died from syphilis for being in the experiment and not getting the treatment. There's a movie about it. You should really go watch it. This experiment is a lot of the reason why there is all of the rules and regulations by the FDA and the USDA and everything for the experiments for testing drugs that we have now, because of the way that this experiment was poorly conducted. So like I said, the big thing with syphilis is it's very, very contagious. It can be treated with penicillin. So what's one thing you want to make sure to ask your patient, their allergies. So syphilis can go, if it is untreated, one of the major